thanks for that introduction, Fiona. I'm going to talk first of all around menopause and transitions around menopause. Um, so I'm just going to go through, as I said, I'm just going to do 20 minutes, and then hopefully we've got time for questions to really go into any aspects that you want to like explore more or understand more. So give a bit of a high level overview to start off with. So just going through what is the menopause, symptoms that might be experienced, and then exploring some symptom management. So, in terms of what is the menopause, so the menopause is when a female stops having periods, it kind of marks the end of having menstrual cycles. And that is kind of, I've put there like diagnosed as such, or kind of stated when a female's not had a period for 12 consecutive months. So that's the point where we say that actually they've reached menopause. It's a normal, natural, biological process that occurs typically, average age is 45 to 55 years. So that's just to kind of give a bit of a starting point. Um, what that looks like, I quite like this diagram. It just shows really nicely, like going through the whole kind of lifespan. So from puberty, you can see the fluctuations in progesterone and estrogen increase through puberty, through menstruation. There's kind of quite a regular pattern. Pregnancy obviously changes, and Katie's going to talk a lot more around postnatal. Um, and you can see there then it's during menopause that actually there's this quite rapid decline in estrogen and progesterone, and that's related to kind of periods stopping at that time point. So there's different stages of the menopause. You've got perimenopause, which is actually when the ovaries are producing less of the estrogen and progesterone I've just mentioned. And it's actually during that phase and that decline in those hormones, so within that perimenopause phase, where actually a lot of negative symptoms might be experienced. And it's kind of that time of transitioning into menopause, which is when menstrual cycles have stopped, and then postmenopause. So it's actually that kind of transition into this perimenopause phase that is when a lot of the symptoms of menopause are kind of described. And just to kind of show why those symptoms might be experienced. So top graph is a normal menstrual cycle where those hormones will fluctuate in the same pattern or should fluctuate in the same pattern every kind of 28 days is the average, but there's a bit of a range there. If someone's been taking the combined oral contraceptive pill, you can see again there's a really nice consistent pattern. And then what happens when we go into perimenopause and the menopause? That's the bottom graph. You can see there that for, this is over a timeline of 5 years, those hormones become really erratic. So you might have high estrogen and low progesterone, or that might flip and you might have high progesterone and low estrogen. The general pattern is they're both declining, but that can be really sporadic, really quite chaotic, I suppose, until they level off within that post-menopause phase. So it's this kind of declining chaos, as I like to describe it, that can actually result in a lot of kind of the negative symptoms that are frequently described. So, in terms of what are those symptoms, I've put on here just the kind of, I would say, most common symptoms. There are a lot more symptoms, and everyone experiences different symptoms, different signs. I'm sure, Katy, from a medical perspective, you'd add in loads of other ones that you've seen when you've been working with different females. So I've just put on here some of the what I describe as the more common, frequently reported symptoms. So, first of all, from a bleeding perspective, periods might become lighter, they might become less frequent. For others, they might become heavier. You might at some point have lighter periods, then other times have heavier periods. It's really quite variable. Things like mid-sleep waking or sleep disturbance. Actually, a lot of sleep disturbance can actually be as a result of like hot flushes or night sweats, headaches and migraines, weight gain. Mood swings, that can actually be to the point I've put there as well, depression, anxiety. So it can be quite severe in terms of mood swings and also how that affects someone's mental health and well-being. Um, Other things there, brain fog. I think that's probably one that is reported most to me as a challenging symptom. How that affects them day to day, how that affects them in training, how that affects at work, in all different situations. Obviously, from especially a training perspective, potentially increased fatigue and increased joint and muscle pain have been quite, again, they're the kind of quite highly reported symptoms. So there's a lot of negative symptoms is probably the thing to highlight there. Some individuals will not experience any symptoms, might not be affected at all, like barely noticeable. Whereas for some females, they might experience really noticeable changes and quite severe symptoms. So again, it's very um, variable, very individual in terms of what someone experiences, how long those symptoms last, and the severity of those symptoms. So suppose from my perspective, it's really crucial to listen to the body and to be able to adapt accordingly. Um, Consulting with healthcare professionals and experts can really help support having a really personalized approach and kind of looking for strategies to manage those changes effectively. I've kind of split it into, in terms of symptom management, into two different categories that are available. One is more a medical perspective of using hormonal replacement therapy, HRT. There's different forms of HRT, and again, different situations where that can be really effective and really helpful for individuals. Um, for others, they might HRT might not be an option, or symptoms might not be as severe, or just preference of approach might be more based on lifestyle. So thinking about exercise, nutrition, recovery, sleep, and stress. So what I was going to focus on more, with me kind of talking around menopause, was around management of symptoms from a lifestyle perspective. And then if we've got any questions that you wanted to ask around HRT, we can kind of leave that to when we've got the 20 minutes of questions at the end so that Katy and I can both kind of do a dual answering of that, especially Katy from a qualified medical perspective. So from a management of symptoms, I've kind of just split them up here into four different categories. One thing I would try and highlight is the importance of exercise and trying to stay active and stay moving, from all different perspectives. One, exercising from a mental health perspective, we know is really beneficial from helping to manage weight gain because that is quite common during perimenopause, but also from a bone health perspective, with the decline in estrogen through perimenopause, there is an increased risk of decrease in bone health from a osteopenia, osteoporosis perspective, but actually strength training and contact type training can really help maintain and support bone health. So things like doing resistance training, adding in plyometrics, so you've got things like jumping, contacts on the ground, that can really help support that kind of bone health. But also, I suppose, just from a change in body, and change in, like, it is common again to have it increase loss of muscle mass during perimenopause. So again, resistance training can really help support maintaining muscle mass, which again is really helpful and beneficial when we're kind of thinking about injury prevention, for kind of all different sports, but for cycling as well. Other sport and exercise that can be really helpful is balance. Again, these are things that can be affected. So whether that's through like yoga or adding in within like your warm up, doing some proprioceptive kind of single leg balancing. I even say just like if you're waiting for a kettle to boil to like balance on one leg and just kind of keep those things involved and included, just so it's not all of a sudden you get to a point where you're finding your balance is effective. Let's just keep that day to day integrated within your daily activity and movement. Cardiovascular exercise, again, really supports heart health and within that kind of post-menopause phase. So, staying cycling will be really important to maintain that cardiovascular health. But again, will also, frequently really supports that mental health as well and well-being. One thing I will say around sport and exercise is you might find that you just need to be more specific with your warm-ups as well. So thinking about whether you need to do a bit more neuromuscular activation, whether you need to have a bit of an extended warm-up or do a little bit of mobility within that. That might all help in terms of that strength, stability, but also to get you going. Sometimes one of the hardest things is to actually get started. Like if you feel fatigued, if you feel low in mood, if you've had a poor night's sleep, sometimes just turning up can be the hardest thing. So I kind of, always say actually really, if you can turn up and just try and do your warm up, even if you don't get any further than that warm up, like that's a really big positive. But normally once you get through that, you feel ready to go and then kind of engage in your normal training routines. So that's sport and exercise side of things. In terms of nutrition, this is nothing groundbreaking other than maintaining a really good balanced diet with fruit, veg, whole grains. One thing I will try and emphasize around is protein inclusion in your diet to help maintain that muscle mass. But then the second one is all around carbohydrates. I think there's quite a lot within kind of social media around fasted training, low carbohydrates, especially to try and avoid weight gain. But actually, we really need to support fueling the body and fueling and providing the energy to be able to continue doing the exercise that you're doing. So, actually, trying to maintain a good balance and include carbohydrates within your meals, within kind of like an hour of doing any exercise as a snack. And also if you're doing exercise for more than like an hour to 75 minutes, depending on the intensity, again, to make sure you're having that carbohydrate inclusion within like that snack within your training. That's just going to really help support maintaining that muscle mass, avoiding fatigue, and enable you to kind of perform and continue to exercise at the intensity that you're aiming to achieve. So that's just I suppose, my one little bugbear in social media around faster training and just really trying to actually support hormone health and kind of cardiovascular health around making sure we're well fueled. And then the other one is around staying hydrated. Again, just trying to maintain that during training, but also throughout the day, of trying to stay on top of that hydration. That can really help with some of the other symptoms that are sometimes experienced. So in terms of recovery and sleep, I've kind of linked these two together because sleep is kind of one of the most basic forms alongside nutrition for recovery. Um, and it can be really obviously challenging if I've just said to you one of the symptoms is you're getting disturbed sleep because of hot flushes. Actually, how do we maintain that? And this might sound really basic, but sometimes thinking about the basics is a really good place to start. So I've put there sleep hygiene. So that's thinking about the environment that you're sleeping in. So is it a nice, cool, dark, quiet environment? Like what clothing, what's your bedding like that can really help support not having those hot flushes or feeling overwhelmed in your sleep. Is your mattress comfortable? Is your pillow comfortable? Those two things sound ridiculous, but the amount of people that just persevere with a really uncomfortable mattress or a pillow that like feels that they're not having good quality of sleep, like just take the time to actually just change that and get it right. It can make a huge difference to not necessarily the quantity of sleep, but the quality of sleep, which both of those things are super important. And then from a recovery perspective, really planning in recovery as part of your training plan. Like we should be doing that anyway, but you might find, especially during perimenopause, you need more recovery than maybe you previously needed. Um, and part of that is an acceptance thing. So actually accepting that maybe I do need a day just to rest. That's really important, and listening to your body for that can be really helpful. But that could also be if you're really struggling, what active kind of rest could you put in? So maybe yoga, which combines working on that balance, but also really helps with that relaxation, um, could be really beneficial. So it might just be a little bit of how do I still achieve what I want to in training, but adapt and kind of rewrite that program that works for you, that allows the balance between maintaining training, doing what you're enjoying, helping with that kind of mental health and well-being, but also ensuring that your body's getting the rest and recovery that it needs during this phase. And then the other one I've got on there is well-being and self-care. So kind of linked with that recovery, some aspect of it is listening to your body and adjusting if need be, but also hopefully if we put in some of these other strategies around sleep, around nutrition, around your warm up, it can allow you to still kind of continue as you would, without having to massively adjust and change everything completely. One aspect that really can increase severity of symptoms alongside the changes in hormones is stress. So, whether that's work stress, general life stress, I tend to call it, that can be a huge factor causing increased symptoms related to menopause. So, really trying to focus on reducing stress is been, for kind of previous females I've worked with, has been kind of one of the biggest game changers, I would say. So for some people, that is meditation, breathing exercises, having a quiet bath where you can just chill out for 5. For others, that is socializing, talking to people, seeing friends and family. So the challenge really for you individually is to try and work out what helps you manage your stress. But more than that, a lot of those strategies can help manage stress, but are there different ways that you can actually remove that stress in the first place? Which is easier said than done when we're trying to juggle full-time work, fitting in going cycling, fitting in extra training, seeing friends, socializing. We all want to do so much, but sometimes you maybe have to take a step back to say, actually, is this too much, and what can I prioritize to try and reduce that kind of root cause of stress in the first place? One thing that doesn't really fit into any of my really nice, neat categories is heat and hot flushes. So I've kind of put this as its own, and potential ways of, not necessarily from a lifestyle perspective, but non-medical strategies that we could use to help manage heat and hot flushes. So they can definitely be worse during exercise, and potentially if we're thinking about within the summer as well, or if you're abroad, so if you're in warm weather. I mean, moving into winter now, you might be grateful if you're having a bit of a hot flush in the UK to keep yourself warm. But generally, there are a couple of things that can really help manage it. One, as I mentioned before, around staying hydrated, that is one thing that can also help manage hot flushes and perceptions of heat. Just thinking about what you're wearing, so lightweight, breathable clothing. What I've not put on there is layers. So actually, can you use layers so that if you are feeling cold, you've got plenty of clothing on, but it's easy to remove them, so it's not kind of a bit of all or nothing. So I do a lot of that when I'm working with climbers or kind of mountain leaders. They're kind of going out needing at the top of a mountain loads of layers, but they've either got one massive jacket on or nothing at all. And when they're having hot flushes, that can be really challenging. So just thinking about clothing has actually been a massive change for some of them. So I thought I'd also include that within the talk to you guys tonight. It's just something to consider. It might sound obvious, but Sometimes when we're in a rush and we've got lots that what's going on in our minds, we don't necessarily think about that. So trying just to plan that and get into a bit of a routine of what maybe works for you. Um, Again, think about the time of day that you're doing the workout, and this is what I mean by like some of the adjustments that you might have to make. So you might still be able to complete all of your normal training, but you might have to maybe think about, do I do that in the morning? Do I do that in the evening when it's maybe a bit cooler, or manageable times of the day? And then if you're really struggling, things like using a cooling towel can be really helpful around the back of your neck or on your forearms. And again, you might need to just start factoring in maybe some breaks if you're out on the road, outside training, just to kind of give yourself five to kind of manage that increase in body temperature that's experienced. Okay, so that's my kind of brief overview. I think I've stuck vaguely to 20 minutes. So, just to summarize, I suppose menopause is a natural process which can result in a lot of negative symptoms. Those experiences can be really individual. Consulting with a healthcare or experts around female health can really help support you from a health and well-being perspective. And there's different options to manage symptoms, both from a kind of pharmaceutical, medical, HRT perspective, or considering different lifestyle strategies, some of which I've just been through, but certainly that's not a extensive list where that's all of the options available. Perfect. So I'm going to hand over to Katy now, if I stop sharing my screen, who's going to talk more around postnatal. And then we'll have, as I've said, hopefully at least 20 minutes at the end to ask any questions that you've got for both of us.
Lovely. Hopefully, because Nat knows how bad I am with technology. Hopefully you can see my PowerPoint. So I have been in Dubai, which has locked me out of my Sport Wales account for a little bit. So apologies, this isn't on a template PowerPoint. But as a bit of a background, I'm Katy. I'm a doctor that works in Sport Wales and the NHS. And I'm part of our female health and performance team in Sport Wales. And I'm specifically kind of looking at the pregnancy and the postpartum stuff that's out there. So my plan is to go through a few bits and pieces about returning to exercise and or training postpartum. I've put the start bit is around cycling, but I have put some bits and pieces in on running as well, because that's currently got the most evidence around it in terms of ways to get back once you've had a baby. So if we look at the medical definition of the postpartum period, it is the period immediately after childbirth, generally lasting 6 to 8 weeks, during which the mother's body undergoes significant physiological and psychological changes to return to a non-pregnant state. So, according to that, we're all done and dusted within 8 weeks. However, if you have had a baby, you know that that's not the case. So the postpartum period does not end after 6 weeks. It probably is more like this. So, it takes several months for wounds to heal, particularly if you've had a cesarean section or a particularly traumatic birth. That is major abdominal surgery, so it does take some time to heal. 2 years for your hormones to kind of rebalance, and then it can take up to 5 years to rediscover your identity, which is I kind of like this quote better than the medical quote. So bear this one in mind, rather than the fact that at 8 weeks we're all supposed to be done and dusted and kind of back to our non-pregnant ways. So postpartum return to exercise. Ideally, it actually starts whilst you're pregnant. So by doing your pelvic floor muscle training early on in pregnancy and throughout the pregnancy on a daily basis, it reduces the odds of your urinary incontinence, not only by half when you're pregnant, but it actually reduces the odds of it in 37% of women in the postpartum period. Okay. So postpartum training is really important to start well before the postpartum period. Um, their birth itself, everyone has a different birth. You may well write the best birth plan in the world, and it all goes very different to how you see it. So a lot of what I say around postpartum um, return to activity is going to be based on what actually happens during and immediately after the birth. Okay. Once again, it's a bit like Nat said with the menopause and not putting too much in the way of expectation on yourself, but remembering that kind of adaptability is the way forward. So if we have a little look at our Chief Medical Officer's guidelines for the UK, post childbirth, we should be aiming for at least 150 minutes of moderate intensity activity per week. And it's quite a little infographic, this. It mentions the pelvic floor exercises. It tries to show that actually activity isn't just going for a run or a bike ride. It's stuff that can be done at home or started at home, and then you can start going out and about. Okay. And it also quite nicely reminds you that you need to listen to your body and start gently. So the considerations you want post childbirth are the type of birth that you've had. It may have been a straightforward, normal vaginal delivery, but you may have had instrumentation, you may have had an episiotomy, um, where you've had a tear, you may have ended up starting a natural birth and then going for a cesarean section. Whatever way it is, you need time to heal and recover. Um, it's also incredibly life-changing, and it doesn't matter how much anybody tells you it will be until you go through it. You don't quite realize how life-changing it is. So you are going to have a new life setup that you are going to want to factor in. And both you, your baby, and or partner might will need to get used to how your new life kind of goes. So the main thing is don't rush it. Um, what we want to make sure before we start our postpartum exercise is that we have no post childbirth bleeding. Okay, so we don't want to do anything if we've got any bleeding that's going on post childbirth. Um, pelvic floor, we've already mentioned, we'd be starting to do that early on during our pregnancy and carrying it on. We want to think about the scar tissue that's going to be there, whether that is a C-section or a tear, um, and whether or not there are stitches that need to come out, or clips, or any kind of wound that hasn't quite healed. We want to have a think about mental health. So for a lot of people, postpartum exercise is really good for their mental health, but for other people, that almost pressure to want to need to exercise and not being able to fit it in can have a slight detriment to people's mental health. Then we've got lactation and breast health, which I'll talk through later. Recti diastasis is where you've got that bulge in your tummy, where your tummy muscles have kind of come apart. And again, I'll talk about that later. You have got this new fatigue and lack of sleep that you're going to have from the baby. So it's factoring in that if you are starting to train or go back to training, to have a think about how you're going to combat your fatigue and lack of sleep. And then your energy balance and environment. So we'll go through some of these now. Um, So exercise generally can begin at 6 weeks once you've had your checkup with your midwife and or GP. Although certainly I found it was just a question, how are you feeling? Yes, I'm fine. My bleeding stopped. Good. And that's a big tick. Um, Running isn't currently advised until 12 weeks. And that's around making sure that your pelvic floor, etc., is strong. And again, I'll go through that later, sorry. Um, this questionnaire has recently come out. It's from the Canadian group that are doing lots of really good work on both pregnancy and postpartum exercise. So it's nothing you need to get signed for by the GP. It's for you yourself, and it's to empower you to feel actually, yes, I am at the stage now where I want to start getting active again. Okay. And you just go through the questions, yes or no, um, and then answer the next page about the type of physical activity that you need or want to do. And if you get no for any of these, then you are fine to crack on with physical activity. Okay. If you get any yeses, then you'd want to speak to a healthcare provider. But if you get all no's, you can crack on. Um, and it's like a self-screening one. There is one for pregnancy and staying active during pregnancy that you can do, but the postpartum one's just come out, and it's a really good tool to empower women to get back to exercise. So we've mentioned pelvic floor. I can't mention pelvic floor enough. Pelvic floor, pelvic floor, pelvic floor. That is the one thing you need to do like forevermore. So pelvic floor muscles first. They're the first muscles that we want to get activated and going. And there's some really nice at-home exercises. Um, so this is a basic program that's just shown on the side there that you can then build up on. So you can do them at home. There are pelvic health specialists out there who specialize particularly in the postpartum period. Um, just make sure that they have had postpartum training if you are going to go and see one privately. But it is pretty straightforward to start doing at home. And then if you run into problems, then maybe see a pelvic health specialist. But it's a must do before you try and move on to introduce any further or more vigorous exercise. Okay. The other thing to do at the start is to try and help your scars. So it's not just pain that you get from scars, but you can get tightness. Um, and that can impact um, your ability to move freely, or also can affect the clothing that you want to wear. So something unperfumed, like bio oil, something like that. Just massage it into the scar area for 5 minutes, a few times a week after you've had a bath or a shower. That's not just a C-section scar. You may find that you've got a perineal scar that needs a little bit of kind of moisturizing oil or massage, particularly if it's quite a prominent scar. Okay. Um, Move in circles up and down, side to side. Do it really gently to start with, and just do little bits if it's uncomfortable, and then just gradually build it up over time. And that massaging will help not only the scar heal, but prevent it from becoming too tight. So returning to training is generally safe once your surgical scars and perineal tears have sufficiently healed. And that could take a number of weeks. And you haven't got any vaginal bleeding, and that vaginal bleeding does not increase when you start your moderate physical activity. Moving medicine, I've put some links on the end of some useful websites. Moving medicine is a really nice website where you can log on to it, search postnatal, and it'll you can click on how many weeks you are postnatally, and it'll give you ideas of what you can do for activity at that time. And then you just highlight the weeks you're on. It'll give you those, and then you can click into each of those activities. So it's quite a nice website, and it's kind of built by some sports and exercise medicine consultants. So it is all medically approved. So if we go back to the bike for a minute, cycling's got loads and loads of benefits in that it's low impact, it's gradable, so you can have an easy session, you can have a hard session. It's really good for your cardiovascular fitness, and you can do it at home on a static bike, or you can go outside, which may well again help with fresh air, mental health, and improve your sleep. I know a lot can't be done for a baby that's waking up every 2 hours, but the quality of sleep you have in between times can be improved with exercise. So this is another example of what moving medicine have basically built on, um, which was a systematic review. So again, all evidence-based. This is for running, but you can see that cycling comes down here kind of week 6 to 8. You start doing low impact exercise and start increasing it. And then weeks 8 to 12, you might want to start thinking about spinning, depending on comfort levels. Okay, but we want to start nice and slowly. Sometimes in the news we celebrate people who come back within 6 weeks and have run a marathon, but strictly speaking, for most of us, that's not a normal thing to do. They have had loads of support around them. It's about taking it easy and doing what your body is allowing you to do. Okay. So padded cycling shorts are essential, but they should be padded mainly on the seat bones, so not the perineum, so not where your scar or tear is, as it can create friction. The padding can create friction. So you might need new cycling shorts where the padding is actually just on your seat bones. Also, if you've had a C-section, just have a little check where the waistband is sitting so that it's not rubbing, because the position you go in on the bike, it may mean that those cycling shorts kind of roll down and sit right over the scar and just irritate it. Okay. You can add additional comfort if you want to, using a kind of sheepskin saddle cover, but again, make sure it fits well and it doesn't slip, because that could give you increased pain over scar sites. Saddle choice, you may well want to get bike fitted again when you're starting to think about going out on the bike, because things will have changed. So body shapes, body positions, hip flexion ranges, all that type of thing will have changed. So you may need a different saddle to what you had before. Wide saddles that support your bottom and reduce pressure on your perineum are probably the best ones to go for. Again, a bit like those cycling shorts, making sure that the pressure is on your seat bones and not on your perineum. So if you're feeling nervous about going back to cycling postpartum, one of the first things to try is, can you do the sit test comfortably? And that's a sit test in a chair, not on a bike saddle, where you sit on a chair and you bring both of your legs up off the floor. So your weight is sitting fully on your kind of seat bones and perineal area. If you're comfortable doing that, then you can do a similar test then on a saddle. If you're not comfortable just sitting in the chair without support on the floor, then you're not ready to get back on your bike. And we know cycling, you need a good core. So you need to kind of done a bit of work on that as well if you're going to start increasing the amount of time you're on a bike. If you're just on a steady indoor bike that you just want to get your legs ticking over, then your core, you can work on your core at the same time as that. Um, but otherwise, there needs to be some core training because it really does feel like there's nothing in the middle anymore once you've had a baby. Um, Pedal a short distance, put your foot down, and then gradually build up and repeat it as often as you need it. So start slowly, listen to your body, and build through milestones. Don't base it on time pressures like at 6 weeks, I have to be cycling this much. Base it on milestones. Um, and you should not have any ongoing pain sitting on or using a bike seat after 12 weeks. If you are, you need to go and see your GP or midwife/health visitor. Quick one on just if you're starting to, if you do some running as well as cycling. 12 weeks is the average time to return to running. It has been shown that there is a higher prevalence of urinary incontinence with women who run postpartum. But that is reduced doing your pelvic floor exercises. Um, there's been a consensus group that have done a lot of work on a screening program, which they use as a sign that you are ready to return to running. And I quite like it because it for most exercise, sorry, this would be what you should be able to do before you start going for more intense exercise. So it just starts with walking for 30 minutes, then single leg balance for 10 seconds on each leg, single leg squats on each leg with 10 reps, jogging on the spot for 1 minute, forward bounce for 10 reps, hopping 10 reps each leg, single leg running man 10 reps, calf raises 20 reps, single leg bridge 20 reps, and single leg sit to stand 20 reps. And that just means that your body is in a really good place to have stress going through it and impact. So that's a really good screen that says, yeah, my body is ready to do some serious work. I mentioned diastasis rectus earlier. So that's where you get that separation of your tummy muscles down the middle. And it is not an uncommon thing. So 60% of women will still have it at 6 weeks, 45% at 6 months, and 33% at 12 months. And it's basically caused by there being increased pressure in your abdomen, and where your muscles meet, it just stretches and they've separated out. Okay. There is a way to check it, and that's lying on your back with your knees bent, feet flat, and then you lift your head, and you might well be able to see or feel a little bulge between where your tummy muscles meet. Okay. A lot of them will get better, but again, a physio specializing in postpartum will be able to help you if you're one of the people that has it still at 12 months, but the majority of them will just settle down by themselves. Kind of mentioned sleep, and I always think it's a slightly weird one to mention postpartum, but physical activity does improve your sleep quality. And it has been shown to reduce your daytime/fatigue in general. So exercising does have some benefits there. Unfortunately, it doesn't make your baby sleep when you want it to, but it will make yours sleep a lot better. Breastfeeding. So it's really important to note how much extra energy you need just from breastfeeding. So that's 500 to 600 kilocalories a day, and that's just breastfeeding. So that's not even if you're deciding to go back to training. So if you're breastfeeding, you really need to look at kind of your nutrition, that you're taking in enough energy if you want to train as well. You need increased protein requirements by 25 grams a day, and you need to hydrate, and that's an extra 900 mils a day. And again, this is not with exercise, this is just breastfeeding. It it takes an awful lot of energy. Um, the good news is there's been some recent studies, again by the Canadian groups, that show that exercise has absolutely no effect on your milk supply or the quality of the milk you're producing. So, by exercising, you are not reducing the milk that you are going to produce for your baby, but you do need to make sure that that energy that is required is topped up. Okay. The one thing breastfeeding can do is result in a temporary decrease in bone mineral density, but this recovers once you stop breastfeeding and once you start your periods again. Um, it's a physiological thing. It's not a thing that can be aided by taking calcium or vitamin D. It is just something to be aware of, but it does recover once your periods start back. A good sports maternity bra is essential, and there are some coming out on the market. So one company that definitely does breastfeeding sports bras is PB. And they provide really good support, but also allow you access should you want to express or feed if your baby's going training with you. Um, it's always been a slight concern for people. Is there a link between breastfeeding and injury risk? The simple answer to that question is no, it does not increase your injury risk. It is perfectly safe to do, but what they did find was that the real injury risk postpartum to women was if they had a current or past eating disorder, or they'd had episodes of underfueling, which had resulted in relative energy disorder. And that increased your postpartum injury risk by 276%. So fueling and nutrition is protection for you postpartum. So it's really important that you get that right. The time when you return to high impact or contact sports doesn't affect injury risk either postpartum. What really matters is staying active during pregnancy if you are able to. So keeping up your pre-pregnancy activity levels cuts your postpartum injury risk by 24%. And if you cut your training by over 50% in early pregnancy, that nearly doubles your postpartum injury risk. So basically, the message is if you are able to stay active, because not only does it benefit your pregnancy, it'll benefit you postpartum as well. But not everyone may be able to return to exercise even if you want to. So if there's ongoing post-birth vaginal bleeding, if there's ongoing childbirth complications, whether that's from the scar, whether that's from a tear, or you're having a delayed recovery from childbirth. If there's poor mental health status that may be worsened by exercise, and that might be a reason not to restart. And if you're at high risk for relative energy deficiency, so poor nutritional intake, or you've had issues in the past with drastic weight loss, etc., then you probably need to have a chat with a medical practitioner or your midwife before returning to exercise. Um, Things like prolapse, urinary incontinence, the rectus diastasis, they're not complete contraindications to returning to exercise. You may just need to modify what you're doing, whether that's wearing a type of support or needing a pessary or modifying how long you're going for, then they're not complete contraindications. The only ones are the ones that are written on that screen. They're the ones you do not want to return to exercise at all with. So, in summary, the postpartum period is a significant transitional life event. It's got a fair few unique barriers and challenges. You've now got a baby that needs consideration when you are going to train, what's going to happen, when are you going to breastfeed if you are breastfeeding, are you going to express beforehand, where are you going to store it, where have you got that's private to feed. It can make following health and wellness guidelines difficult. So we say 150 minutes per week of exercise, but lots of things can interrupt that. Robust social and emotional support is essential, and a strong support system enables you to kind of progress towards what you want to achieve. But it needs to be individualized. You can't compare yourself to the mother next door. It's got to be for you and based on what you can do, and it needs to be gradual and symptom-based progression. It needs to be remembered that you need time to heal from pregnancy and childbirth. Yeah, if you feel ready to do it, go through your checklist and go for it, but in a steady and controlled way. So these are a couple of resources. The cycling poster at the top is actually what is on the Active Pregnancy Foundation. If you type in cycling, it's got a little booklet on both pregnancy and postpartum. And then you've got moving medicine and the postpartum screening for return to exercise link is there also. And I will stop sharing. Hopefully.
Thank you so much, Katy and Natalie. I thought that was incredibly interesting. So yeah, does anyone have any questions? We can go on for longer than past, if considering we've only got 1 minute. So yeah, go for it, Sarah.
Yeah, thanks. My question, Natalie, you mentioned about cardio being helpful for managing symptoms. Is there anything particular cardio wise? You were talking lots of zone 2, you talking threshold, is there benefits to getting, heart rate really high? Or is it we're talking more kind of steady state stuff?
I almost forgot to unmute. That is a good question. There isn't a whole host of research, obviously, that kind of tells you around what zones we benefit from. What I would say is try and have I would say keep like your normal training plan if you can, in terms of the balance between some steady state, some zones 2, some threshold, because again, like we know that different intensities can really help and support cardiovascular health in different ways.